Aloha, I am Dr. Eliza Kim, and this is Everyday Wellness. We're joined here today by Dr. Kristen Coles, a naturopathic physician and a licensed acupuncturist. Welcome.
Thank you.
And could you tell us a little bit about yourself before we start?
Yes. So I'm a naturopathic doctor. I practice as a primary care doctor here in the state of Hawaii. I also have several different specialties in addition to doing primary care. I work currently at Steelsmith Natural Health Center, and that's over in Waikiki. We have a great practice there. We see children, adults, geriatrics. Yes. We do all sorts of things from diagnosing and treating many different types of diseases using natural medicine.
Well, wonderful. Well, that said, I would like to maybe do the next 2 shows on the thyroid conditions, because this is something that we hear a lot about and we talk about. It's something that I know it's a gland that we have really not talked about previously, and just now recently it's really starting to come up. And I know that a lot of men and women out there suffer from the conditions that can be a borderline. It goes either misdiagnosed or they're just right on the cusp of having that condition but not quite there yet, so they've been dismissed. So let's start with where the thyroid gland is.
Yeah, and I'd like to touch on that. It's about 20 million Americans are diagnosed with some sort of thyroid condition. So it is a fairly common condition that we do see, and in my practice I see a lot of undiagnosed, subclinical, and even overtly clinical different types of thyroid conditions. About 60% of people with a thyroid condition are undiagnosed. They are not properly worked up. Maybe they've had certain tests done that might not give you the whole picture. We'll get into that in more detail. So improper testing or just not tested at all. So 60% of people with a thyroid issue are going undiagnosed. That's fairly significant. And the thyroid gland itself is an endocrine gland. The endocrine system has a number of different organs that work within it. Endocrine means internal. These are the systems that produce hormones. And there are many different types of hormones. Some of us are more familiar with things like, testosterone as a hormone, estrogen, progesterone. We'll talk about those at some point, but there are hormones in the thyroid because it is an endocrine system. And hormones are chemical messengers that go across the entire body. Every single cell, every tissue, every organ is under the influence of our hormones. Highly important. The thyroid itself sits in our neck. It is a butterfly-shaped organ, and it's actually one of the smallest of our endocrine organs, and it is small, but it has wide-ranging effects.
Right. And we call that sometimes a thermostat, a body's natural thermostat, because one of the symptoms and signs that we start to get is that we may have what we call a broken thermostat, feel hot, cold. Many of the patients, they'll come in with cold hands, cold feet, and that tends to, we can trace it back to the thyroid, but then, that almost always will get dismissed as a circulation issue. So, yes.
I love that analogy about the thermostat, especially with the thyroid, because we can actually even think about in a few minutes when we get into how the thyroid actually works and the hormones that it's using to affect these things like our thermoregulation, our internal temperature. It's good to have a basic understanding of how it does what it does, and we can actually use that analogy of a thermostat. The thyroid being an endocrine gland and a hormonal gland, it operates under what's called a negative feedback system. Okay. And I want to use this idea of the thermostat to explain what that means. Because our thyroid gland, which is here in our neck, is in the endocrine system, the brain actually is the main operator of this organ, versus something like our liver. The liver operates in and of itself as an organ. It's not an endocrine gland. It's not an endocrine organ.
Right.
The endocrine organs like the thyroid gland, the adrenal glands, the ovaries, the testes, those are some of our main endocrine glands. They all operate under the sort of the brain itself.
Right.
And the brain is thought of as the thermostat. What sets a temperature? That's our thermostat. So let's say we set a temperature at 72 degrees, okay? And in our house,
Right. Right.
not inside our body, in our house. We set it. We set our thermostat to 92 degrees. We have electrical signals and a vent that all work together to see what is the temperature inside. And based on that, it either sends out cold air to cool us off,
Right.
or it shuts down and doesn't run because it's too cold. The thyroid gland and the brain work similar.
Okay.
The brain and something called the anterior pituitary, which is part of our brain, a very important part. This is the part of the brain that tests our blood all the time. It has a lot of blood flow, and I like to think of it like a little gecko sticking its tongue out every second, testing the blood. And it can measure all the levels of all our hormones in every given second.
Right.
That is the thermostat, sensing, where's the temperature in the house. And based on that, it then sends signals to the thyroid to tell the thyroid if it needs to work harder or not work as much.
Right.
So let's give some names to these hormones so we understand what we're talking about.
Yeah.
There's some crucial hormones related to the thyroid gland. TSH stands for thyroid stimulating hormone. And TSH is the messenger from the brain to the thyroid. So TSH is what's sent out if the brain notices that there's either not enough thyroid around or too much thyroid.
Right.
The thyroid gland itself actually makes its own hormones. And these hormones are called T4 and T3.
Okay.
Okay? So we have TSH from the brain
Right.
to the thyroid, and then the thyroid itself makes hormones T4 and T3.
Okay.
T4 and T3 then go into the entire system, and T4, we have about 80% of our thyroid hormone is T4. It's the most abundant.
Oh, yeah.
Okay. However, T3, we have maybe about 20% or a little less of T3, so not as much T3, but T3 is the biologically active form of thyroid.
Right. Right.
So this is the hormone that actually goes to every single cell, and it does this thing where it regulates our temperature.
Right.
Okay, so that's the hormone that has the most effect on all these different parts in the system. And in a minute, we'll talk about a lot of different signs and symptoms that we get when we don't have T3 in the system acting on our cells. Because not only is it sort of these cold hands and feet, but there's a lot of other symptoms.
Exactly.
So when T4 and T3 are being circulated in the body, that's what the brain measures, and the brain, or the pituitary gland, if there's enough T4 and T3 circulating, it sends a sort of steady state of TSH to the thyroid.
Right.
Okay? Let's say that we are in a deficient thyroid state. So our thyroid is not functioning optimally. We also call that hypothyroid, low thyroid.
Right.
There's not enough hormone, thyroid hormone, T4 and T3.
So that's like what we call the sluggish
A
thyroid.
sluggish thyroid. There's not enough T4 and T3, which are those active thyroid hormones. If that is circulating and we don't have enough T4 and T3, the brain senses that, and it actually elevates the TSH.
Right.
So this is where I find a lot of my patients get the most confused when we're trying to talk about thyroid, is that a sluggish or deficient or hypothyroid state actually has a high number of TSH when we measure it.
Right.
Because that's actually coming from the brain, and it's trying to tell the thyroid, work harder,
Right.
Hello, wake up. Like,
Exactly.
you need to do a little bit better.
Right.
So
right.
it's actually, sending out more and higher signals. All of these hormones can actually be tested in labs, and we'll get into that in a moment. But I just wanted to go through the T4 and T3, which act in the periphery. There are active thyroid hormones versus TSH.
Right.
And that's why it's called a negative feedback system, because a hypo, a low, sluggish thyroid state, actually has a high TSH.
Right, exactly. And so what if your pituitary is broken, which I find that quite often in our patients, that they've had such a chronic thing going on, not only with the thyroid, but also with the pituitary that's not working properly. So now, the pituitary is no longer able to stimulate or tell the right messages to stimulate certain hormones or the thyroid hormones.
That's actually a pretty severe type of condition, because that's a primary hypothyroid state. And if the anterior pituitary has been damaged, it could be actually structurally damaged from trauma accident.
Like car accidents.
It could be PTSD, and stress can actually shut the pituitary down.
Absolutely.
When the pituitary is affected, that will cause thyroid dysfunction, it will cause adrenal gland dysfunction, it will cause, if we're a woman, changes in our ovarian system. It's called a hypothalamic pituitary axis. So it's the brain stimulating those glands, and you will actually get system-wide issues, not just a thyroid issue.
Right, right. And I do remember when I was in school, we were always about that Harewor's chart. I don't know if you remember that, with how every gland and organ in your body is connected to make that whole entire endocrine system.
Yes.
And that kind of explains what happens. It's a domino effect of dysfunctions of a gland or organs that will cause another organ or gland to dysfunction.
It is. The endocrine system is fascinating. It is intricate, and it can be very confusing to many people. Very complicated. I do recommend for patients, if they have endocrine system issues, issues that they think fit into the thyroid and the adrenal and their hormonal ovarian system, that they seek out a very, very good functional medicine doctor, a very good naturopathic medical doctor, someone who understands the endocrine system and how all of those players work together, because it is complicated to try to understand as a layperson, I do find.
Right. And how do you define or differentiate that from having other types of hormonal conditions, because they all seem to kind of overlap each other as far as symptoms and signs go. So I would like to sort of go into the signs and symptoms of what happens when the thyroid gland is not functioning properly.
Great. So there are two ways that the thyroid gland can malfunction. We can either have a deficient or a sluggish thyroid, which is called hypothyroid, or we can actually have a thyroid that is overly functioning. It is stimulating and spitting out too much hormone. That's called hyperthyroid. Okay, so hypothyroid is the most common type of thyroid imbalance, so that's the deficient thyroid. So I'm going to jump into that first, and we'll talk a lot about that.
So let me just for the viewers out there, hypo, HYPO, is a deficient one, and hyper, HYPER, is the excess. So I just want to make that very clear, just in case they do have questions regarding that, because it's when we're speaking it, it's sort of difficult to understand always.
Yeah. Okay. And differentiating between hypo or low thyroid and hyper or excess thyroid state is done in a couple different ways. First of all, we have to look at the signs and the symptoms, which we're going to get into. And then the second thing that I'm always doing is I'm running a complete and full thyroid panel for my patients. Because with that, we are going to actually get a look at the number of the TSH. We're going to look at the thyroid hormones themselves. And then we're going to look at I always look at a few other things that I'll get into. So a low thyroid or a sluggish thyroid state, which is hypothyroid, that has a number of different symptoms and signs. You began with talking about the thermoregulation, our internal temperature. Patients with low thyroid often have a lower temperature than 98.6. You can actually see them kind of consistently in the 97s. They can feel cold most of the time. They can sometimes have cold hands, cold feet, or they can just feel like they always need to have a sweater on. They can feel fatigued and lethargic. They can have weakness. They can have apathy or even depression. I've definitely seen some chronic cases of depression that had an undiagnosed thyroid condition that was the cause. They can have constipation, sluggishness in the bowels. They can have then issues with digestion with that. They can have dry skin, dry hair, brittle hair. A key sign is thinning of the lateral aspect of the eyebrows.
Interesting.
If you see people who only have a half an eyebrow and then they're drawing in the rest of it or not, they just have a half an eyebrow, that's always a sign for me that there could be a long-standing thyroid issue. We can have issues with infertility. That's a big one. So in almost every female patient that I see who I'm working up for fertility issues or even changes in their menstrual cycle or abnormalities, and especially in fertility, always going to look at the thyroid.
Absolutely.
On physical exam, we see things like decreased tendon reflexes. So it even can go as far to impact the nervous system itself.
Absolutely,
Given long-standing bad hypothyroid, we can actually get confusion, issues with memory. If a baby is born in a low thyroid state, that actually will stunt their mental development. It can become a very concerning disease if left undiagnosed for too long.
So many women, they will complain about hair falling out, more hair falling out in bunches, and also they will feel kind of foggy, like their brain just feels foggy. They'll start to complain about the weight gain around the waist. That's one of the most common things. But one of the things I have seen, though, too, is that most of these many of these hypothyroid women or men, they tend to have been hyper in their their late teens to early 20s. And then it seems to, there's definitely that pattern of just go, 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 go. And then they start to go into hypo as they get older because it's almost like they started running out of fumes.
That is the connection between the adrenal glands and the thyroid. Because while we're going to talk about these separately, they are so interconnected. And the adrenals and the thyroid are two glands that are basically back to back. They are twin systems in what they do and how they support our body. And it's often when the adrenal glands start to become fatigued, which depending on how much stress we have and depending how much of a type A personality we are and all the different things that happen in our life, that can start happening even in the 20s, but often in the 30s. And we do see that hypothyroid is a more common condition in women than in men.
For sure.
And we do see that condition begins to develop between the ages of around 20 to 40. That's the most common time that the thyroid definitely begins to actually show this sluggishness, and we start to get the symptoms that they don't go away. We might start with one, which is just a little bit of brain fog, and we start caffeinating to deal with it. Then we might get a little bit of constipation, and then we maybe use some things to deal with that, and then we maybe have our hair change a little bit, or we have a little bit of weight